Hello there. Thank you. Ken Jenks here. See you. It's not the normal icons on our screen. Whew.
Hello? This is Kristen Dwyer.
Yep, I can hear you.
Oh, okay, good.
You're good. We're running a couple minutes behind getting everybody up.
Okay. I'm not doing anything, am I?
Right now?
Right.
No. No, we haven't started yet.
Okay. Thought I missed something.
Bruce,
Yes,
how are you?
good. They're working on getting everybody up right now.
Very good. Hello, Kristen.
As we know, it's a process.
Are you just gonna stay full screen or are you just?
You want Mallory to talk?
No.
I don't see Mary yet.
Are you going to show us all up the screen who you have in? Under me, do you put Director of Health? So I want to.
Yeah.
Hello? Oh, I'm here.
Hi, how are you?
I'm great, thank you. I don't seem to have video. Not sure what's going on.
I unmuted.
Okay, thank you. Just another minute, everybody. We're working on a couple of technical difficulties.
I don't seem to have video. Does anyone else have video?
They're
Deb.
working on it.
Oh, okay, never mind, sorry.
Bruce?
Yes,
Why are you masked?
because I have the tech people working right next to me.
Okay. Good job.
I've already got that in there, I think. try with,
No, this, okay, Ken, good. Good, getting there. Leader. Leader.
It's just like your computer, you may need to adjust the
Oh, what do you
volume
do?
at some point. So you just do.
Charlie.
Hmm.
All right, who do we, all we're missing now is Mary? she's
No, I'm here.
here, okay. Are you on video or just listen?
I'm on video, but I don't know how to show me. I don't know what to do to get, oh, wait a minute. I think I got it. Okay,
Hey.
here I am.
why do we have a bad echo?
Could be.
Someday I'll get this right.
Mine's off.
No, I mean his is on. Then you can't.
That's okay.
How do I change my background?
I was on a Zoom conference and it allowed me to do it, and that's how I did it, and I don't know how to change it. I'm still at the beach,
I wish I was at the beach.
Good deal.
which is fine with me. That's right. Okay, there. Looks like we can buy some t-shirts there.
Yeah, I wanted a backdrop. I couldn't afford one of those cool college ones with little
Oh,
goes everywhere.
it
Yeah.
works. It works.
But they are for sale for a mere $25 if you want
Wow.
that.
All right, Mr. Chairman, we are live. We're picking up a little echo here. Can you check on that, Trevor?
Just turn the speaker down.
We just got to turn one of the speakers down. We do have Charlie with us here.
We're all set?
Yes, we are.
Yeah, we all wanted to be live, actually, Bruce, you're right. Okay. So welcome to the August 31st, 2020 meeting in the Yarmouth Board of Health. Hillard Bosky, I'm the chair of the board, and we're going to start with attendance as usual. Mary,
Here.
that's good. Eric,
Present.
Deborah. Deb,
She's muted.
I'm unmuted, sorry, here.
very much so. Okay, Charlie. Okay, Charlie, there we go. Thank you very much. Is Director Murphy present?
Yes.
All right, we're all good to go. For the record, pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law, this is a remote participation meeting. anyone needs instructions of how to be watching or just to join the meeting, certainly on the town website, there's plenty of information there. So why don't we get right to the agenda as usual? The first item would be public comment. If there's anyone who was able to figure all this out and is joining us, here's your moment. We welcome all questions, statements.
The Zoom master says we've received no comments on the chat line.
So we'll take one at a time. It looks like we're done already then. Okay. Hey, moving in. Okay, number 2, there's an update, coronavirus. And the first item I see is statistics, graphs, and charts. Director Murphy, what do we have?
Well, just wanted to update the board and the public. What we have is an overall, as of today, 137 cases from the beginning of March, 11 total. And we are following 3 active cases. We've had 3 deaths. So with 131 that have recovered. So what I tried to do then is to put that in our usual graphs that we see each week, and let me have the Zoom master call up the first informational screen graph, which will be this one.
Yep.
And hope we turn that.
There we go.
So this is a good screen that we have that really shows the active cases that we saw that it, peaked out in May and then has gone flattened way out the curve. As we can see, more have recovered in this area here. This graph just shows where we are. We've gone, as you can see down here, we've gone quite a few days without a case. These other times we're covering and following people as the positive cases come in. So you can see in Yarmouth, we've really flattened the curve to very few cases.
Thank you.
Next sheet, next graph is, Mr. Chairman, is yours. You could take a look at and explain this one.
Sure. As you can see, the first date there is March 11th. Are we able to move the screen over, the graph over a little bit so we can see this week's stats? Right now, it's not visible, at least to me, as all our pictures are covering late August on the graph. Any chance?
I can see it.
We can.
8/26, yeah.
Okay.
August 26th, yep.
It's interesting. For whatever reason, I'm not. Anyway, just looking, the blue vertical lines are just the cases that, positive cases of specific days, and the orange line there are the new positives that are averaged out, just following every 7 days, getting an average. And I think the one thing I can point out is just some recent increase in activity.
Mhm.
Generally, you look for, around 2 weeks after something, possible events or a party or more popular, more people here, whatever. I don't know if anything's occurred, but it's just a little bit more activity in the last week or so. So, I mean, just keep in mind, each is a person. Anyone who's positive, of course, could be quite ill. They could have to go to the hospital. They could just be left with medical problems for a long time. They could be passing the infection on to someone else. So each case obviously is important. So any questions? Anyone comments on the statistics? If not, we can move on the agenda here.
I think one of the good things showing it this way or on either graph is right now it's just showing on this graph, you can see a few weeks there were 0 cases and a couple of weeks we're just carrying 1 case. But there was no uptick after, let's say, On the beaches, Memorial Day, there's no big hiccup after that. And there's no big uptick after school graduation that week and the following week when there were family gatherings. So nor have we seen anything on July 4th when more people were down. So if you look at that and plus all the additional people that are in Yarmouth, we have not seen an uptick. So I think that's kind of like key factors or points within these graphs.
Yeah, we were really concerned about graduation. They did a great job. So we were really happy to see. It was just flat afterward. So.
Okay, why don't we go to the next chart? And we'll flip this. Did you want to go over this, Mr. Chairman, or did you?
I hadn't seen it before, but we could all take a look together. Anyone's free to make a comment here, just to break down a little bit. Anyone see some trends here? Anything anyone wants to point out? It's a simple enough list here.
Well, the older folks are definitely not the ones who have been struck the most here in Yarmouth.
Very, very true. We've got 9 cases for people 80 and above. In the 70s, there are 12 cases. Any thoughts, anyone, on why that may be the case?
Because we older folks are very careful.
I agree with that. Yes, I think that has something to do with it.
Right.
Anyone else? So,
I seem to be in the prime bracket.
Yes.
Beware.
Would you like to share anything with us?
No, I've been since I've been working since March, and I've been washing. My hands are drier than they've ever been ever.
And you're having Purell with your meals?
You and some.
So I think, Mr. Chairman, just showing the public the importance of it is the spread across the different age demographics.
Sure.
I think everybody kind of just normally assumes that might be more in the older category, but it's kind of spread right in the middle areas there. So, and we're looking at probably as school starts up, maybe breaking down that age 1 to 20, breaking that down to 1 through 10 and 10 through 20 to get a little idea as we monitor the schools. We'll try to break that category down either to another one or maybe three categories.
That would be great. And as for the breakdown of the demographics by age, one thing you can tell by this is who's getting the sickest here, who gets hospitalized here. And so that may be the people who are, 70 and above. I don't know, but that's what the science is telling you.
Right, the people that have more health complications also.
Sure, even though compromised for whatever reason, yes. But you can thank Phil. He's been doing a great job with the statistics. Please pass that on to him.
I will. Phil's done a great job, and it's almost 24/7 because on weekends we get cases that come in that he takes a quick look at it, make sure we have it's the right town, because sometimes we find out it's a different town or a different street in a different town. So he's able to cull through it real quick and touch base with the contact tracing as needed. Then we pick it up, or we'll talk over the weekend and then pick it up during the week also. So he's right on it. We send, as a reminder, a positive case in any day that it comes in. We automatically send it to the fire and police department, so they're aware of the location only.
I mean, when I email Phil, it's like 10 minutes, he responds. So this is very much a full-time job for him.
It is, on top of doing all his other duties, inspecting the restaurants and the pools. And today he was out water sampling all the beaches for our last round of sampling prior to Labor Day. So we can get the one last water quality clearance prior to this long weekend.
Okay, thank you.
Okay. Great.
Next, we have it's ABCC, which is the Alcohol Beverages Control Commission. And they are, there's an issue about violations here dealing with alcohol. Director Murphy.
Yeah, well, one second, Mr. Chairman. I think if I'm looking, the first one we're talking about is the school's reopening plan. I think I have that set up first. If we could just take that part of the order that
Sure, that's great.
okay, thank you. To go over the school's reopening plan, I have Assistant Superintendent of Schools Ken Jenks available that will discuss it, along with nurse leader Kristen Dwyer that has all the other school nurses under her direction. So I think with that, what you have in your packet is I've taken some excerpts from the school reopening plan that was presented from the by the superintendent and assistant superintendent to the selectmen last Tuesday. And I tried to call out the portions that deal with COVID. So I think with that, I'll turn it over to Ken and we can kind of walk through the slides as you give a little update on everything, if that sounds fine.
Good evening and thank you for the opportunity to present. This has truly been a team effort. I can't say enough how we've been lucky enough in the school system to work pretty consistently and closely with Bruce, his counterpart Kristen and Dennis, as well as Kristen Dwyer, our incredible nurse leader. So we've been a team effort. We've not invented things on our own. Like everyone, we're following the state guidance. And often the real questions is, what does that look like locally, concretely, where there's open areas for discussion? I don't want to belabor the school document. You've probably had an opportunity to read it or look at it. Since then, details have been added about high-touch surfaces, exactly what those are, and how many times during the course of a day do we anticipate having those covered. But you can see the core of the school plan is safely opening and providing educational opportunities for students, maintaining masking and physical distancing as probably the two core tenets to controlling transmission, but having the correct PPP, whether it's a standard classroom, perhaps someone working with our students who are more fragile, as well as our medical waiting room, if you will. We have plenty of equipment. Like everyone, we've used our federal grants to ensure having the first half of the year enough masks for everyone, can first consistently replace them, face shields for everyone who would want one, gloves, sanitizer, thermal thermometers, and so on and so forth. There'll be stations. I'm sorry, Bruce, I'm kind of jumping stations. Cleaning, we've worked to add hours with our custodial vendors to make sure during the day.
Kind of just put a commitment to action. I think you're kind of going off this thing. That's fine.
Oh, okay. Yes, I'm sorry. I guess I was kind of trying to hit the key points.
Yep.
The bottom line is we were committed early on to, it's important for students to have social emotional development, be amongst their peers, and you can do that safely. We really believe that, following the guidance from the CDC, DESC, and local agencies. And so the plan, when you take a chance to look through the whole document, covers in upper level detail how we're approaching each of those tasks. And subdividing that, there's more detail that's been worked out with different parts of the operation. Food service, what does that look like? And we were able to check with both town health departments on that and those pieces. But if you carry that through, we believe in the whole child. In school personnel with training and dedication, they take care of the academics, they work with people, and we can have students safely in school because it's not mutually exclusive. Our communities have done a phenomenal job at limiting transmission as you look at those statistics. We believe we're going to model that by, again, traffic flow in schools, masks, proper hand washing, distancing at all times. How do you get kids on and off buses? Limited numbers of passengers on buses. So we're following the requirements to have a program that meets state requirements, meets local requirements, and our students can still learn. They look a little different these days, our schools, only 8 or 9 students in an instructional space. But all of the documents as you go through are there. And if it's okay, I'll turn it over to Kristen because I've been known to go on for an hour on the subject, so I can gladly do that. But I also
Before we turn it over to
have you
Kristen,
ask our questions.
before we go over to Kristen, let's go to the next page here.
Yes,
You can just kind of go over the
Yes.
critical safety requirements of the mask, the hand wash. I think
Yeah.
you've talked about that just a little bit,
Yes.
and then I have a page after that.
but again, as you can see, these are the standard pieces. Again, that state guidance was great. We all know it's constantly about masks, hand washing. If you can't wash your hands, use some sanitizer. We walked through with both Bruce and Kristen from Dennis to select the room that the isolation room, if you will, the medical waiting room, to ensure that if there is a student or a staff member that has indicated the signs of some kind of COVID or a COVID symptom, they can be safely kept there, isolated from the rest of the school until someone can pick them up, action can be taken. That is not the regular nurse's office usually, or if it is that space, the nurse's offices were relocated. We wanted to follow the guidance there to make sure, again, if a person was to have symptoms, we can make sure everybody's following a procedure to ensure we don't have transmission, we can properly track things, and then that student can be assessed and then further action taken by the family when the student gets home or the staff member. Everything.
Very good. Can we go to the next slide that
Yes,
shows?
absolutely, Bruce. I'm sorry.
That's fine.
Yeah, a few
And you can
pictures and-
hopefully this shows you how the rooms are set up and that the seats are spaced apart.
Yeah, and if you want to see color pictures, go to the school website. You can see the desks where, 8 to 12 students in a classroom. You can see the PPE listed. Those things are very important parts of, we all know it's not just about the mask, it's about taking precautions in other scenario situations. Again, we have some special programs with students with specialized needs, and sometimes you're looking at the disposable gowns and the gloves and the masks and other such things. And so
Okay.
the supplies we need.
Yeah, let's go to the next page. We've got, you talked a little bit about the cleaning and sanitizing, but you're looking at cleaning the whole facility, the room cleaning, special cleaning practices. Go to the next
Yes.
one. We
Yep.
talked about, you want to just talk about how you looked at the heating and ventilation systems?
Yeah. And as we know, that's a concern for many folks. We brought in a engineering firm, specialist firm, to give us the independent assessment, because we know sometimes we change the filters every year. We do the maintenance, we maintain them, we clean them and all that. And so that's being done again. But we also figured we'll bring an outside agency in because people wanted to know, is there enough airflow in each room? How many times per hour? Is it 8 or 10 or 12, depending on the specific system, where all the air is exchanged? That report's being put together now. They came in the summer, they did it. As you probably imagine, sometimes you can't turn those reports around that quickly by the time we got the engineers on board and things, but we'll have that soon. We know for staff, particularly the teachers and the assistants, that's a high interest item. But quite frankly, we've always worked to maintain, there's new filters every year, the system's cleaned. In the past, we occasionally had the county come in to do any checks on circulation, and we've never had any significant problems where they said, oh my gosh, you can't use these spaces. So we anticipate there'll be a few things, I'm sure it will say, oh, you have to address this and this, but we brought them in as well to make sure there's an extra layer of protection.
I think that that's important for the people at home and everybody to hear that you've looked at that.
Yes.
I think the next page talks about food service. You want to just say that that's going to be up a little different. It's not going to be at the cafeteria. It's going to be in the
Yes.
in the rooms, even for breakfast. You want to just go over that
Yes,
and then
as-
quickly the
as you-
bus. Yep.
Absolutely. And then maybe after the bus transportation, we'll do, but food services, you might imagine, you can't be putting 300 kids in a cafeteria, if you will, and having them have lunch. So food will be delivered to the classroom. That's a new operation, novelty for many people. When students get off buses in the morning, we used to have breakfast, and there was CAFs, and there were little kiosks here and there, so they could grab and go and make sure they get their food. That'll be continued. So no student has to start school. If they want breakfast, they'll be able to receive it. The best news we received in about the last 2 weeks is the US government today, the USDA announcement that the program they allowed in the summer to make sure everybody got fed will continue now during the school year, because it wasn't clear that was going to happen. And so that way we're more readily able to make sure every student just take a breakfast. You need a breakfast, take a breakfast. Lunches will be delivered. It will start fundamentally like the summer program with sandwiches, not hot food and those things. And eventually we'd like to transition to some warm food in the appropriate containers, because many students, we want to make sure they get a hot meal a day. So it's a little different, but they'll be in their classrooms, keeping in mind only 8 to 12 students in a classroom, and they'll be able to eat because they're all more than 6 feet apart. So if they take their mask down and they're eating, you've met the distance requirement, if you will. So we don't have to worry about that being a problem. And we've worked through that and how that's going to look and how do you take care of the desks afterwards. So good work in progress.
Okay, very good. And we got bus transportation. You want to just show the bus, the next slide?
Sure. And if you look at the next slide, you can see the
Yep.
little dots. Those dots are my existence. A bus that used to hold about, 55, 60 students in theory. Technically, they'll tell you it's like 72, and that's for micro bodies. In the real world, maybe 55, 60 max. Now you have 23 students per bus with an assistant. And it's taken some work, and the bus company is working through 32% capacity, but because a lot of families are not going to have the students take the bus, or about 20-ish% are doing a remote, we can transport the students probably in one full shift the way we used to each level of school. So far that's looking good. As you might imagine, between runs, high touch surfaces will be addressed, and they'll be disinfected daily as well, the buses, much like how you're handling inside buildings.
And before we turn it over to Kristen to talk a little about the nursing, you want to just say how the school is set up, and I'm thinking of the high school or even the middle school in cohorts and by
Yes.
grade.
Yeah. As you might imagine, the goal was to have cohorts, identifiable groups of students. In your work on the Board of Health, you understand the value of that for contact tracing. So bus cohorts are arranged that way. School cohorts, even at the high school, were arranged so pretty consistently that group of students is together. We were trying to avoid that A period, there's 15 kids who were together, and they go to another period and they're scattered in 6 classes. We've maintained cohorts. If you look at the middle school, you have a group of, say, 14 students. I'm using large numbers, and because of the seating, you have those smaller cohorts. You have 14 students, say, in a room. Teachers circulate, sort of like that European model. So you don't have students circulating throughout the day. You're limiting the amount of contact. And so you might have a teacher traveling between a couple rooms, but we're constantly saying the same group of students stays together. So if there is an infection, it's more readily identifiable who was impacted. And you just don't want all that mixing and matching, for lack of a better term. And so that was kind of a major miracle in trying to get scheduling done that way compared to how it may have usually been done in the past.
Thank you very much. We'll go down a couple pages and bring in our lead nurse
Yes.
that works with all the nurses, and she can talk about what we're going to have for protocols for responding to COVID. Oh, yeah, you keep going back. Yeah, you went right by it. Keep going back. It was like 2 pages after that. There you go. Okay. So if Kristen could come in now, Kristen Dwyer, that's our district nurse leader, and kind of give us an update of what you've set up for your regular nurse, the separate nursing COVID room, and what you're going to be, your nurses will be doing in each of the schools.
Yep. Hi, this is Kristen Dwyer. So in the original guidance that came out on July 22nd regarding the medical waiting room, it talked about the purpose was that for students to have a place to go located near the nurses and or other health related office for a student that was presenting with COVID-like symptoms, because they need to be separated from the general population or not in a health room that is where a child is either taking medication or diabetic care or any other sort of circumstance outside of COVID-like symptoms. They then changed the guidance to the rooms back on, let's see here, hold on August 18th, and they actually specifically kind of made the suggestion, if feasible, that children with COVID-like symptoms, if it's feasible, to have their own separate waiting room, kind of like an isolation room. So what we did is, in looking at the way to present the best case scenario, is to be able to, most of the health offices already had sometimes a room within a room as an isolation or a private area. So what we ended up doing is looking at all of our medical current health offices, we call them health offices or nurse's office, and those became our medical waiting room, because within that room, it gave children at least 6 feet apart if they didn't have a separation isolation room, and it also gave them a bathroom so that they weren't mixing with the general public if they were to have symptoms down the hallway, as well as running water. And then we looked at other spaces to then provide the children that don't have COVID symptoms, the kid that falls, breaks their arm, knock on wood, that doesn't happen, cuts, slaps.
Can't hear you, Kristen.
You lost audio.
Yeah, we lost you, Kristen.
Kristen, we can't hear you now.
Oh, sorry, my internet goes in and out.
Okay.
It also would be for diabetic care for students. So the health office is now for the two separate. So with those two rooms, based on the CDC guidelines, the original ones that you guys have in front of you are actually from July 17th, I believe, and they were updated initially on July 17th, and they were revised August 20th. The difference is the fever is no longer 100.4. The fever is 100.0 during our assessment. So I am actually meeting with all of the nurses tomorrow, as we physically distance 6 feet apart and or wear a mask. We'll be meeting to go over our procedures of when we have a student that presents with COVID-like symptoms, how we're going to go about doing that. I know it's been brought up, is we just send the child down to the nurse's office. I'm saying no. I've talked with other nurse leaders. Basically, the nurse in the building would go down to that child's room, pull the child out. We would already have looked up the information from that child, whether or not they had an underlying health issue such as asthma, seasonal allergies, chronic cough, cough due to medication, anything like that. And then what we would do is, based on our assessment, as we walk through the hallway, we would have given them a surgical mask, which is the requirement, and we would do an assessment. I would have my thermometer, I would have my pulse ox, I would have my stethoscope, and as we walked down the hallway, we would assess the child. And before we got to either the health office or the COVID office, medical waiting room, the determination would be made by us where that child would go. So we're not bringing that child into the health office. Other students are receiving other medical care outside of COVID-like symptoms, because you didn't want to cross-contaminate. They would go to the medical waiting room. Somebody would be in the medical waiting room who is, by state guidelines, allowed to supervise the children in that room. and then who is first aid CPR certified. And then I would go back to the office, or my nurses would go back to their office. They would notify the family that their child is in the health office with these, presenting with these symptoms. That child would be picked up by the parents. The parents would then bring the child to the physician, and from there, the physician would assess the child. And based on the physician's decision and assessment, that child would either go for COVID testing for COVID-19 with the physician's referral, or if that child felt, or if that physician felt that the child did not have COVID, but felt that it had a differential diagnosis or alternate diagnosis, such as, say, strep or laryngitis or pharyngitis or anything like that, then they could return to school with a physician's note stating the alternative diagnosis. If the student is referred for testing, that student will be out until the test comes back negative. But again, the guidance that you see here has actually changed to August 20th, which states they're actually still out for 14 days, even though the gold standard is the molecular PCR. The bottom line is it's most sensitive between days like 4 and 5. However, that's if you become symptomatic. Symptoms can still come between 2 and 14 days. So even though you have a negative COVID test, they're still encouraging, and their guidance still stands, that you'll be out for 14 days before you can return to school, because you can still develop symptoms, and maybe the PCR wasn't sensitive enough to capture your positive diagnosis to the 14th day, depending on when you become symptomatic. I think that's about it. The list basically of the symptoms are the same, except that the temperature did go from 100.4 to 100.0 as one of the symptoms.
Very good, Chris. I think that's very helpful. But I think for the public and the board members, that the extra work strain that's going to go on the nursing office, because if you just think that every day there's probably 30, 40 kids that go down to the nurse's station
Yes.
that just aren't feeling well, whether it's a allergy, tummy aches, they just don't feel well. So the nurses having these kids come in with various symptoms all day. I'm at the high school, it could be 40, 50, 60 kids a day.
Right.
And that's not including the kids that called in sick, that they're going to have to go back through the absentee line to go over why those kids have been out for a couple days. So you want to just touch base on that?
Yep, absolutely. It's going to be overwhelming. Any child parent that calls in their child sick, they cannot just leave a message. They have to then speak to the nurse, and based on our assessment, again, of looking back at their diagnosis and or have you been sick, or anyone in your family been sick, have you had a known exposure to COVID, etc., then we would follow up on those calls, and based on those calls, then we go further follow up if that were any of those were yes, and I would follow up with Bruce. If the child, once they're dismissed, we would follow up with phone calls. And if the parents called us back, right, sometimes they don't call us back. The issue is going to be managing the health office that it stands for every child, not every child, but a large population do receive daily medications, ADHD medications, anti-anxiety medications, especially in the high school, our diabetics, our asthmatics, that we service on a daily basis of 40 to 50 visits just a day for each school. And then, even the younger grades. And then to have the medical waiting room, which that person is of 18 years old and is certified in CPR and first aid, which is the guidelines. However, they can't make an assessment. So the issue is going to be for nurses. We're assessing the child, we're communicating with the family, everything else that comes in, the healthy population that comes in for their daily routine medications, diabetic care, what have you not, any incidentals outside of, your fever, your cough, your shortness of breath, your sore throat, all of those things which are COVID symptoms. We will be, in addition to also managing from afar the COVID space or medical waiting room to ensure the safety, because you can't leave kids not managed or supervised without the appropriate staff person in place. So it's definitely going to be a huge juggling. It's slightly concerning, but I think we'll be able, I'm hoping that I would like to hire some more people, but we are hiring and in the process of working on the medical waiting room, which is going to be a huge, which will be a huge relief because there's no way that we can visually watch one room to another because not every room is next to each other. So it's going to definitely be busy.
Thanks very much, Kristen. And we had done a little of this in March when COVID was just coming in. We're contacting and touching base and calling. It was almost daily back and forth with the
Overwhelming.
schools and the nurse. So we know what we're going to be gearing up for starting this fall, especially when it's allergy season and flu season coming in. So it is overwhelming, and it will be something daily that the health department will be in contact with working with the schools.
Right. And to add on to that, just our phone calls alone, every single child that comes to our office, we document in a SNAP program. It's a nursing program. Because as nurses, we are licensed and we follow the physician's orders, and our physician is Dr. Comer, who is our district doctor. So any medications that we dispense, we have orders for and or from their own primary physician. But again, it's documentation, because if it's not documented, it didn't happen, it didn't exist. It is a licensure issue for us to maintain and to practice within our scope, which includes assessing, documentation, and notification through all levels, whether it's home and or with Bruce and the district, depending on what's going on within the district.
Thank
I
you
have a
very much.
question.
Oh, Mr. Chairman, good. Open to the board.
Yes, Kristen, is there any possibility of utilizing MRC volunteers for the waiting room?
I'm not sure. I would have to check with Ken. Do they have all the certifications? Do they have
Typically they
CPR,
do.
first
I can't answer
aid?
that, but typically they do, and it seems like it would be a suitable role for them to at least to be able to have some additional help.
Mhm.
It's a possibility anyway.
I'll look into that also, Kristen, and let you know.
Yeah, thank you.
Okay.
What will be the plan if a student is found to be COVID positive? What happens with the other students in that classroom?
So if a student it depends on the scenario. It depends on whether or not the student is sent home from school and then is tested once they're home, or they're found positive prior. Because if the student is positive, let's just say they're positive, they leave school on Wednesday and they don't feel good, or Monday or Tuesday. They get tested on Thursday and they get the results that they're positive. We have to go back 48 hours from the day the test was administered in that cohort. And what happens is hold on. All right, sorry, my kids. So what happens, sorry. So what happens is the day that they're positive, the test result, the results are positive, say it takes them 5 days. But the day that they take the test, say the test was administered on Thursday, I go back 2 days, 48 hours, and I find out who their cohort is. And whoever is in that cohort, based on the guidance from the 20th, then what would happen is every single person in that classroom would then self-isolate and get a test. If they decided not to do the test, then they would have to stay for 14 days. And even if that was negative, they would still stay out for 14 days because they could still develop symptoms 14 days after the exposure. So the quick reference guide there was updated on August 20th. I could read it. Each protocol is similar for each scenario, whether it's on bus or not. And then once we would have a positive, then we'd be dealing with the Board of Health and Bruce, depending on whether it's Towns of Dennis or Yarmouth. And then we would start the contact tracing. But that's why they encourage the cohort. So every single child in that room is the same cohort as they move through the day. That way you're limiting the amount of exposure if you were to have a positive student or staff member in that room. Does that help?
That's great, thank you.
Okay.
Bruce, how are things getting coordinated from the nursing staff to the health department and Maven? How's all that going to be coordinated?
Well, recently they just allowing the health department looks at the state tracking system, Maven, that we track, that will show active cases and negative tests. So that's what we monitor 24/7. they are now just going to allow, I think of last week, the school nurses to look at Maven just to see if there's a positive case, but not, the nurses cannot do any contact tracing. That will go through our VNA or the state contact tracers. But it will at least allow the school to look to see if there's a positive test or a negative test, because what happens is, as Kristen was saying, the child gets tested, but we might not get the results for 3 or 4 days. And that just prolongs the time period students may be out. So we'll be working with the school nurses on that.
Yeah, and just to add on to what Bruce is saying is we currently don't have access to Maven, and we wouldn't be part of the contact tracing because it's just, that's a whole nother layer of busy that we wouldn't be able to handle just because we'd already be. And so we're trying to, and the nurses in the schools are having hopefully seating charts set up for each classroom. So within the cohort, if Johnny in the front of the classroom is positive, but Sarah, who sits all the way in the back, she's say 12 plus feet apart, the likelihood is not. It doesn't mean that she wouldn't be included in that cohort, but it is information that the doctor is going to want to know, because not only are we 6 feet apart, we have also implemented mask wearing at 6 feet apart, and we're washing our hands.
That's great. And maybe you can share with us your thoughts about the influenza season.
Yeah, so the state mandate came out from Baker that every child 6 months and older who is academics and even secondary will have a flu vaccine prior to December 31st, and anyone transferring into school will also have to then have an influenza vaccine when they're available. I know there's some resistance on flu vaccines and vaccines in general. I am a proponent of vaccines. My kids actually on Thursday already got their flu vaccine. But I think it's important to really encourage any family member to do that, because it's going to decrease the overload of cross sicknesses at a time when COVID may likely peak because of increased indoor activity, and along with influenza. Sorry, it's the witching hour, 6 o'clock at night. And it also will increase the flu vaccine, because the flu is also all the same similar symptoms, influenza A and B. So I have also been talking with, and I know CVS does a lot of stuff as well, but I was looking at maybe going through the Barnstable Health Commission and the VNA to set up sites at the schools for family members. It's free of charge, and do a drive-through style, hopefully, to help any parents that can't get their kids during the day, during office hours at a doctor's office, that we can do after school or before school influenza vaccines. It's not something that the nurses usually do. It would be another, we can do them. I mean, we do shots, but it would be another layer that probably would not be able to be as successful, I think, as if we did not do a little bit more marketing and have the VNA come out and do it for each school for the younger grades to help parents out. So that is something that I have been thinking about and working on.
We can talk more on that, Kristen. It would just be social distancing the kids, the parents, and so forth,
Right.
when they come in by appointments and so forth.
Right.
It can be a lot to that.
Right.
Because they should be going to their local
Doctor,
or if they just need the flu shots, they can go to any of the pharmacies.
CVS's, pharmacies.
Right.
Board members have any comments or questions?
Good luck.
Yeah.
Thank
you.
I mean, it seems like they've been incredibly thorough, like trying to figure out all the different situations that could happen.
I mean, we're as thorough as you can be in an ever-changing midst of a pandemic. But like I've said, the things that are constant is physical distancing, wear a face mask if you can't maintain it, and wash your hands. And will cases pop up? Probably, but we can only do what we can do as staff, students, family, community to be as successful as we can when we reenter.
That's great. Thank you for your effort. And if this board is helping in any way, please speak up. Okay. Okay. Director Murphy, is there anything else here?
No, I'd just like to thank both the Assistant Superintendent Ken Jinks for coming in, and especially Kristen Dwyer. I know it's
Kristen, yeah.
a little different at night, so we really appreciate you taking the time out and working with us on this. I think it's very helpful for the
No
board and the
problem.
public. Thank you very much.
Thank you very much.
Thank you. And
Thank
again,
you.
can't say enough about Bruce, his team, Mallory, everybody helping us out. Thank you.
Okay, let's move on then for the state alcohol violations, Director Murphy.
Okay, let me.
Hold on, I'm sorry. Can I jump in?
Oh,
Can I get off?
Yep,
What's
so
up,
go
Kate?
ahead.
Can I jump off the call?
Yes,
Yes.
you can.
Okay, thank you.
You're all
Have a good
set. You
night.
and Ken are all set.
Dismissed.
You're
Dismissed.
excused.
All right, let me scroll through that. Yep, keep going. Let's see what we come up with here. School safety plan. Okay, right. Okay. Well, let me just check where we are. So on the violations that were received from the State Alcohol Commission, I'm just trying to see. Right, here we go. I think we can go with that one right here. Leave that one right up. Go back. Yep, right here. We received a violation from the on 2 locations from the state alcohol violations. They were in 2 weekends ago and cited 2 locations within town. We don't have their written warning that we're hoping to get Friday or today, so I can't release those names until I have the hard copy. But they are in the process of 2 violations to to 2 bars from their late night inspections. They had people sitting at the bar, people not wearing masks at the bar, nor were they ordering food when they're ordering alcohol at the same time. So that was 2 violations from ABC that will be coming down that we're aware of. The other violation that we see before us was one that was filed, and people can file complaints either through the local health department or through the state website that automatically goes to the Department of Labor Standards, DLS, or to the Attorney General's office. So there's several way people can file a complaint and how they're looked at. So both DLS, Department of Labor Standards, the Attorney General office will check with the health department, local health department, and ask, have we received any additional violations on a particular property? On this particular one that we have right here, Colucci's, we had a couple violations of staff not wearing masks, and they also received similar complaints at the Department of Labor Standards. After discussing, on this particular case, a written warning was issued. There's no fines at this time, but a written warning. Reinspection, or I should say, re-inspections and stop-ins to confirm compliance has been done on several occasions since this was delivered. They've been working very good with us. As we can see, this one came in August 18th, and we've probably been out there 3 or 4 times to make sure they've been in compliance. So overall, we probably received 2 to 3 complaints of COVID violations per day of the governor's orders, and whether that's from not wearing masks in retail stores, grocery stores, people walking to the beach, people going on the boardwalk, passing on the boardwalk, are the type of complaints that we'll receive. We reach out to the people as much as we can. We talk to the business to make sure their staff is wearing masks and making sure it's posted on the door that masks are required. So that's something that we're spending each day on. And it's usually myself and one or two inspectors spending some of their time following up with various businesses. Overall, townwide, we're doing very good. You know, we hear that from when we talk to other health agents and our county health agent workshops that we have each Tuesday. So I think townwide, we seem to be doing better, more people wearing masks. A couple warnings that the state has issued is, I think, been helpful in stressing our educational points. So I think we're doing better, but we still need to stay vigilant with our enforcement and our education, Mr. Chairman and Board.
Thank you. Board members, any questions for Bruce?
Okay, why don't we scroll down and see what we still, yeah.
On one of the bars, they already had a warning, didn't they? By history?
I believe correct. We believe that one of the ones that already had a warning has received a second or third warning, but I have not received the official letter that we see like this one up here. So I don't want to say anything until we receive that official written documentation.
Fair enough. Okay, thanks.
So if we could scroll down, let's keep on going. That's just the end of the order. We'll get anything else. Okay, this is a complaint the department received. I don't know how easy it is to read, but it was directed to the Yarmouth Board of Selectmen, Board of Health, Police Department, and State Police. Was a complaint received regarding the Moose Lodge of people not wearing masks and social distancing. So this was a written complaint that we received and the selectmen received also. So we went out to, we're working on this case with DLS right now.
Can you forward a copy of the letter to the board?
Yes, it was in our packet.
It's in all the board's packet,
Okay,
public record.
okay. I obviously didn't see it. Okay, great.
Yeah, we have, I have talked to, both myself and Phil have talked to the Moose Lodge about addressing this letter and making corrections, which they stated they have made corrections and steps they've taken to address these issues. So we'll continue talking to them and monitoring this situation also. And I'm just on a side note on this particular case, the Moose Lodge on 28, over the last week, somebody dumped on their property 32 mattresses right up in the corner. And illegal dumping on their property. The police are looking into it, but as of now, there's no identified person of who dumped the mattresses. The Moose has put a request into the town administration and selectmen. Would they waive the dump fee to bring the mattresses to the landfill? Because it's roughly $15 a mattress, and it would be expensive to bring the 32 or so mattresses to the landfill. So unfortunately, it's very unsightly. It is being addressed, and the selectmen should be addressing this shortly, either before their meeting or needing to wait to their next meeting to pass a decision if that will be waived at the landfill. Okay. Next, what we have up, Mr. Zoom Master. That's the last one. Oh, we're missing a couple then. 48. Did we have, what I was looking for is the chart here. Did we go? Oh, right there. Here we go. So what's ahead of what's before this one? No, nope, no, no, keep going. We'll just go right to the chart then. Yeah, keep going. This is the school nursing information. So keep going past the school information. And two more sheets. Okay, right, okay, oh, yeah, let's go to the, yeah, right, this one right here. Keep going so I can read the top of it. Right there you go. So what I wanted to bring to the board's attention is the governor, I guess you go to the chat, we'll go backwards. The governor has come out, and then we can turn that one, of what the population rates are for communities that have COVID within them. And they come up with a color coding. No, right there you go. Now, if you can turn that, they've come up with a color coding system to show communities that have a higher incident rate. We're getting there. So it's difficult because we're unable to turn the charts ahead of time because it spins back. So we have to turn them during the presentation if it's able to do. If not, we can work on this chart.
Well, it's in our packet anyway.
Yeah, I'm just thinking for the people that we have at
public.
home.
Right.
Yeah,
right.
the hundreds of people, or at least 3 of them that we probably are
Right.
watching. But I'll go with it. As you can see, there's different areas in Massachusetts that are colored up. And the red is obviously the highest, and down to gray, which is what we are. Next to us is green, which is Barnstable, means they have at least less than 4 cases per 1,000. So per 100,000. So based on this, it allows schools to open, depending what color you're in, and where we're in gray, which is the lowest color, allows the school to open to in-school teaching. So that's what the school based their data on to allow in school. So I think there's another sheet right there. No, oh, no, yeah, go back one. Yeah, now turn this one. See if you can turn this one. You had it earlier. Somehow or another, you turned them both. I don't know why it keeps going, but yeah, here we go.
There it is.
There we go. So this one that we have here was part of the school presentation. We just updated it when the school committee went with the selectmen. And it's just giving the statistics of what we have in Yarmouth and what Dennis has. It has it as white, which means gray, and that we're the lowest. But I think it's interesting to look at the 2 towns within the DY school district of the total number of cases that we have, Yarmouth 128 and Dennis at 101. But then we look at, I think the interesting thing is total tests per town right here. Total tests per town of 5 for Yarmouth of 5,746. And Dennis has only tested 3,000 approximately. So you can see we're, of course, a little bit larger town, so we are getting more testing. And the number of positive tests over the last 2 weeks was 3 for Yarmouth and then 1 for Dennis. So percent of positivity, 0.4 in Yarmouth and 0.3 in Dennis. So I thought that was interesting. Then you can compare it to the Barnstable County itself of the total number of cases in Barnstable County of 1,594. And then the total tests within Barnstable County of 55,921. And the percent of positivity is 0.45. So the school committee used that information to look at the governor's information and new guidance for back to school. It's something that we also follow when this information comes out each Wednesday. when the state comes out and issues town by town information. So that's something that we've been monitoring for the last 3 months when we look at how the town's set. So I thought that would be interesting to the board and to the public. Just good information, Mr. Chairman.
Very good.
So that that does conclude the points that we wanted to make covering the status of COVID within Yarmouth, showing the number of cases that we've had, showing the number of cases compared to Dennis, showing what our demographics are. I think it gives a good overview of what we're doing. And I think the citizens of Yarmouth are doing well by wearing masks and social distancing. And I think the education continues out there, and I think we're doing well. We continue to work with various town departments and businesses in town to stress that they remind their employees the importance of wearing masks and social distancing, and just not when they're at work, after work, and if they go out or socialize, the importance of maintaining vigilance precautions.
Okay. Board members, any questions?
Things are working okay with the town hall being open?
Yes, the town hall has been open for a couple of weeks. Right now, it's the upstairs town hall is working. They do limit the number of people coming in. They have somebody there checking the people come in, writing their names and phone numbers in reason of business case we have to track them back. But plexiglass has been installed. We'll be phasing in downstairs and other offices very soon. We've had made appointments within the health department if we had to meet people. Some of our meetings that I've met with is people outside town hall at the picnic table. We've met with some builders and developers going over plans and so forth. So yes, we're meeting with people as we go. So it's good to get back to business a little bit. And we can probably remember tomorrow we're meeting up here because tomorrow is voting day. So we're not downstairs. So more people will be coming in downstairs tomorrow. So it'll be town hall will be open all day tomorrow then.
Mhm.
Not necessary to get into all the inspections offices, but
Right.
they can get in and vote. And they'll have social distancing marking and so forth. And
Good.
they'll have masks available if needed.
Great.
Right. Okay. Bruce, anything else? New or old business?
No, I don't, Mr. Chairman. I think we're working on a potential possible septic variance in a business under hazardous storage that wants to expand somewhat, that we'll have one for later in September that I'll get back to you to set a date on.
Okay, the only question I had overall is any questions for people who are not wearing masks, who just stating that they have medical problems and unable to wear a mask? Any issues there?
Yes, we do. We have one that's one business that people do visit, a retail business, and they have one person that has a medical condition, does not need to wear a mask. And that person's either 1 or 2 or 1 or 3 at the front counter. And but unfortunately, the others weren't wearing masks too several times that were in there. So we're still trying to work with that retail business. And matter of fact, today we just received a complaint through the Department of Labor Standards that was referred to them. So we need to follow that up again with both the retail business. This is probably at least the 4th time, and then contacting back to Labor Standards on the status and whether that it will be a warning issued or not.
All right, not ideal, but okay, thanks. Nothing else? We could close it up here. Someone want to make a motion? We could adjourn.
Next meeting? When's the next meeting?
Haven't set the date yet. I'd like to wait a week just to before we set the date, because I
Fine.
want to see, we're waiting for a couple things to come in.
Okay,
But I am looking at probably doing a robocall this week out to the general public, just to give them an update of where we sit with the new governor's color coding, where we sit with our demographics, and to remind everybody to be safe and social distance this weekend.
and keep wearing masks. Even Dr. Burks is saying that.
Since we've already got through Memorial Day, 4th of July, and we've been doing very well, let's keep up our mask and social distancing over Labor Day.
Right, right.
Okay. Anyone,
I move that we adjourn this meeting.
second? Someone?
Second.
Second,
So much.
third.
Okay, we're definitely gonna do this then. All in favor, raise your hand, say aye.
Aye.
Okay, thank you. Charlie, saying aye? Go
Yeah.
for it. No,
Charlie's got a nod, yeah.
yeah, that's the most we'll get here tonight. Okay, so thank you, everyone. Stay safe, and that's it for the meeting. Take care.
Thank you, everyone. Have a
Good
good
night.
night.